Welcome. In the previous session, we looked at EGOT alkaloids, and we said one of the EGOT alkaloid, namely egotamine and dihydroegotamine, is used in the treatment of migraines. Now, if you can remember, when we were looking at serotonin, we said also the triptans, which were agonists at 5-HT1B/1D receptors, were also used to treat acute attacks of migraine. So today we'll be looking at migraines specifically. So welcome all. My name is Wallace Munyeli, and I'm the redactor. Now, what are migraines? Now, migraines are unilateral pulsatile headache caused by dilation and inflammation of the affected cerebral vessels. Okay, so they are, and migraines usually have an aura of nausea and vomiting, vicious scotomas, with or without hemianopsia, speech abnormalities. Then they are usually followed by one-sided temporal headaches, which last for a few hours to up to 48 hours, okay? And the severity usually differ, okay? So this pain, the headache will follow the trigeminal nerve distribution in the cranial arteries. And one of the substances involved in migraine pathology is calcitonin gene-related peptide. Okay, so they are either mild and moderate attacks are usually controlled by non-steroidal anti-inflammatory drugs such as your salicylic acid, the aspirin, whereas severe attacks require EGOT alkaloids or triptans for termination. Okay, so let's start with the EGOT alkaloid, namely egotamine. So egotamine, the route of administration is either oral or sublingual, or dihydroegotamine, which has parenteral administration, can be used to abort acute attack of migraine. Now, their absorption is enhanced by caffeine, okay? So, and they are powerful vasoconstrictors. It is usually combined with egotamine, now the caffeine. This drug, however, they increase the nausea and vomiting during the migraine attack. I told you a migraine, it has an aura of nausea and vomiting. So before one gets a migraine attack, they will feel the nausea, they can vomit, they can have vicious scotomas with or without hemianopsia, they can have even speech abnormalities. Okay, so the other drugs which can be used in the treatment of migraines are the triptans. Okay, and we have one of them known as sumatriptan. Route of administration is via the subcutaneous route. It is the drug of choice for aborting acute attack of migraine. It is a selective agonist at 5-HT1B/1D receptors. It also suppresses the vomiting of migraine. So, and that is why it is the drug of choice, because egotamine will increase the nausea and vomiting, but this one will suppress. It is a short-acting drug and has a very low bioavailability. But we have another drug which is known as provatriptan, which is the longest acting triptan. Okay, in fact, it has a half-life of 27 hours. Then you have another one known as rizatriptan, which is the fastest acting. Okay, other drugs useful are zolmitriptan, elatriptan, naratriptan, and almotriptan. These are the triptans. And remember, they are agonists, selective agonists at 5-HT1B/1D receptors. Okay, by binding to this receptor, they cause vasoconstriction of the cranial vessels. Hence, the pain receptors won't be stretched. Now, all of these drugs can cause coronary vasospasm, the triptans, and therefore they are strongly contraindicated in people with ischemic heart disease. Okay, so they are contraindicated in people with ischemic heart disease. They are also contraindicated with people with in people with hypertension, epilepsy, pregnancy, liver and renal impairment. So especially the drugs naratriptan and erythriptan, they are contraindicated in severe renal and hepatic diseases. Whereas drugs such as provatriptan, also naratriptan and erythriptan are contraindicated in people with peripheral vascular diseases such as the Raynaud's phenomena. Okay, so but one thing which you should know is that these triptans are quite expensive. So that is one thing which you should remember. Now, triptans and ergotamine should not be administered within 24 hours of each other. That is a point. Even here, I've written for you here. Okay. So please remember also I've said both triptans and ergot alkaloids cause coronary vasospasm, hence are contraindicated in ischemic heart disease or the coronary artery disease. Provatriptan is the longest acting with a half-life of 27 hours. Rizatriptan is the fastest. Sumatriptan is the drug of choice for aborting acute attack of migraine because it will also suppress the nausea and vomiting. Okay. So let's look at some pharmacokinetic properties. So in terms of oral availability, in terms of oral bioavailability, the maximum is naratriptan. The one which has maximum oral bioavailability is naratriptan, with minimum is sumatriptan. The longest acting is provatriptan that has the longest half-life. Sumatriptan has the shortest. The fastest acting is rizatriptan. The slowest acting is provatriptan. The one which has maximum plasma protein binding is erythriptan, with minimum plasma protein binding is sumatriptan. Okay, so for patients with history of coronary artery disease or the ischemic heart disease, triptans or ergotamine are contraindicated. Therefore, for such patients who have an ischemic heart disease or a coronary artery disease, you don't use the triptans. Instead, you use opioids like the intranasal butorphanol. Okay, so they are used to abort the acute severe migraines. Now, prophylaxis of migraine is required if the attacks are frequent. That is, if one has more than 2 to 3 migraine attacks per month. Now, the drugs useful for prophylaxis are, so one, propranolol. It is you remember propranolol, non-selective beta blocker, first generation. It is the most commonly used drug, but I would not use this drug for asthmatics. Okay. It is used for prophylaxis of migraine, but we have others, timolol, atenolol, metoprolol, nadolol can be used, but drugs with intrinsic sympathomimetic activity are ineffective. Remember the drugs with intrinsic sympathomimetic activity, cerebrolol, oxyprenol, pindolol, and acebutolol. Okay, these 4 drugs have intrinsic sympathomimetic activity: cerebrolol, oxyprenol, pindolol, and acebutolol. So they are ineffective for the prophylaxis. Now, another drug which can use for prophylaxis of migraines are calcium channel blockers, such as flunarizine, which also blocks sodium channels. Okay, then also you can use methoxide, which I told you is an ergot alkaloid, but remember I told you it can cause subendocardial and retroperitoneal fibrosis. You can also use cyproheptadine. Okay, you can also use tricyclic antidepressants such as amitriptyline. You can also use clonidine. Remember, clonidine was an alpha-2 agonist together with the drugs such as alpha-methyl dopa. So they can be also used orally for prophylaxis of migraine attacks. You can also use topiramate, which is an anticonvulsant drug. Okay. Also, valproate and gabapentin, they possess some prophylactic activity. Then we have botulinum toxin, has been recently approved for prophylaxis when headaches occur more than 14 days per month. It is usually given every 12 weeks as multiple injections around the head and neck to try to dull future headache symptoms. So, okay, here you can see management of migraine, drugs for acute attack and drugs for prophylaxis. For acute attack, you start with NSAIDs, the non-steroidal anti-inflammatory drugs. I know you know them. If they do not control, you move on to triptans or ergotamine with caffeine. Caffeine, I told you, was just to enhance the absorption of the ergotamines. If that does not control, you use opioids or droperidol. Then, but if we have opioid tolerant patients, you can use propofol. Okay, propofol. Okay, then for prophylaxis, I said you can use the beta blockers. Propranolol is the drug of choice, but you cannot use this in asthmatic patients because you know it will also block the beta 2 receptors in the lungs, and that will exacerbate the asthma. You can also use timolol or nadolol. You can also use calcium channel blockers such as lunalizine or verapamil. You can also use tricyclic antidepressants such as amitriptyline. You can also use antiepileptics such as topiramate or valproate and gabapentin. You can also use niraparib, cyproheptadine, clonidine, and botulinum toxin A. Okay, so we are done with migraines, and I believe with that you can now you have at least an idea of how you can control migraine. So next session we'll be looking at prostaglandins. I think this will be an interesting session. But I want you to remember one thing, that we were using egonavin or your igometrin to control postpartum hemorrhage, but you can use a derivative of a prostaglandin known as carbaprost, which is a derivative of a prostaglandin F2 alpha to control the same. So keep that in mind, and see you in the next. Thank you.